So peak flow meter is it looks like that, in which you want to assess, you want to make sure whether the patient who's asthmatic, is it controlled on asthma or it is not controlled on asthma. So patients who does not have, or you're not really sure whether the patient is controlled or not, this will provide you the objective idea whether the patient is controlled or not. So how, we'll see that we first need to look up these different parts. This is the mouthpiece, which should be discarded after each use. It is removable. You will remove this mouthpiece after usage. Now you see here, and there is a pointer, red pointer, which should be at 0 before you give to the patient. You explain that you need to inhale, full inhaled, and then forcefully expire in this, through this mouthpiece into the calibration. So the patient has to do it forcefully, and you may want to give patient 2 3 times so that he can understand well that on complete inhalation, then he has to forcefully exhale, not just exhale, forcefully exhale. Okay, like you do it in a balloon. So then if after the patient has done this, you will see that this pointer that you put it on 0, it comes a little up. So the more it is up, the better is the lung volume. So the good range is between 350, 400 to 500. This is the good range and acceptable range. So above 500 is clear acceptable. Between 400 and 500, it is also acceptable. But below this, 350 or 300, you need to consider that probably the patient needs some advice why the control is not good. So, for instance, the patient who is asthmatic and he's on some medications, like he's on Ventolin, small acting beta 2 agonist, and some long acting, also LABA, also long acting beta 2 agonist. But the values are between 300, 350. So you may want to increase the dose and check the insulin and check the inhaler techniques. If all of things are great, then you would like to step up the patient. And you also would like to assess the serial measurements. Probably the patient, when it came initially to you, he just has only 250 to 200. The volume was just 250. So you give some treatment, and then you reassess for after 1 week, then the value comes out to be 350. Now this will tell you that okay, now this patient is improving. So with the not just numbers, you also need the serial or the progression. Whether the patient has progressing good lung outputs, then it is also a good idea that you measure the peak expiratory flow meters readings on each visit of the asthma patients while you are assessing the patient with asthma, in order to make sure that you're going in the right direction, you're not missing things, you're not missing any acute flare-ups. So this is how you're going to assess for a peak expiratory flow meters. So this is the mouthpiece, and this is the calibration. Okay, so it's a very simple instrument, and it should be there in the primary healthcare. So please try to look up all these things when you go inside the primary healthcare. Okay, so that's about it.